Okay, we all set, Bridget? Okay, let's get going. Welcome to the November meeting of the Health and Human Services Committee. Bridget, do we have attendance? Right, we're all set. Do we have a motion to approve the minutes of October 25th?
I'll make that motion.
I'll second the motion.
Got that, Bridget, for the second?
I'll make
Discussion?
the motion.
Okay, discussion? All in favor? Aye.
Aye.
Opposed? Carried. Great. The next item on the agenda is the renewal of the contract with Captain Community Services. That's a renewal of the 3-year agreement. Do we need to discuss that? I think it's pretty
No.
clear. It's just a renewal of the 3-year agreement. Okay, do we have a motion to approve that?
So moved.
I'll make the motion.
Okay, well, it's a
Supervisor
motion made
Winnie.
by Joe and seconded by Supervisor Winnie. Discussion? All in favor? Aye.
Aye.
Opposed? Carried. Next item on the agenda is the renewal agreement with James McGinnis and Associates, and that's for software system and support services for preschool. Do we have a motion?
I'll make that motion.
Do we have a second?
I'll second
I'll second the motion.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried. Next item on the agenda is the Saratoga County Child and Family Services Plan. And Tina, you were going to read the entire plan for us today, weren't you?
It's done? Yeah. Thank you, Chairman. No, I just want to request a resolution authorizing the chairman of the board to sign the annual update on the Family and Children's Services Plan. The local district is required to submit and develop a plan and send it to New York State Office of Children's Services, and it's a multi-year plan. It's a 5-year plan, so in this case, our plan was from 2018 to 2023. And the request that I have today is just for the authorization for the chairman to sign an annual update, because we have to send in an annual update each year. So it's kind of a housekeeping item, but
Yeah, sounds good. It certainly is a comprehensive document. Do we have a motion to approve that?
Make the motion.
Do we have a second?
I'll second the motion.
Wood.
Motion made and seconded. Discussion? All in favor?
Aye.
Opposed? Carried. Next item on the agenda tonight is the Safe Harbor Program. It's the resolution to approve the acceptance of $43,350. Tina, what do we need to know about that in addition to that?
yeah, that, again, that's a request for a resolution to accept that additional money from Office of Children and Family Services for the program of $43,350, and also to authorize a renewal of the agreement with Saratoga Center for the Family to meet the needs of the youth that are identified in sex and human trafficking. The renewal agreement would cover January 1st of 2022 through December 31st of 2022, not in the amount not to exceed $35,350. Originally, when this program started in 2016, we were awarded a 5-year grant, and to develop a human traffic awareness program and to develop the critical services. And we contracted with Saratoga Center for the Family to be the lead agency for the human traffic program. And then last month, we were notified on October 15th that we are going to be receiving we were notified we're going to get money this year for in the amount of the $43,500 for 2022, which was not anticipated or expected that we were going to receive those funds. So now I need to request a budget amendment for increased appropriations and revenues. It is 100% state funded, so there'll be no budget impact. And the reason for the difference in the $43,350 to the contract amount for Saratoga Center, there is the $8,000 that we keep in-house for reimbursement of staff time spent in working with these human trafficking individuals.
Wow.
Sounds good. Do we have a motion for that resolution?
So moved.
I'll make the motion.
So we had a motion by Supervisor Grasso and a second by Supervisor Winnie. Discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
Thank you, Tina. Other business? Any other business? Dr. Kules? Just a quick question on, how we're doing with COVID. I know the numbers across the country are kind of going up a little bit as our Saratoga counties. How are we doing on hospitalizations, deaths, the test to stay program?
Yep. Okay. Good afternoon. Thank you. Thank you very much. Much like the Northeast and really most of the country as a whole, we are certainly experiencing an increase in cases. This is a 3 or 4-fold increase over what we saw pre-Thanksgiving last year. Much of this is due, 98, 99% of, maybe even higher of what's circulating is the Delta virus. And if you combine that with waning immunity in individuals, you get a fair degree of transmission, which is what we're seeing now. Our booster vaccination rates are higher than both the national and state average. Here, when we look at seniors, we are at 52.5% of seniors have received a booster, compared with the state at 30.2 and the U.S. at 40.6. We need to continue to work to get that number higher, not just for seniors, but for everyone. We're holding more clinics again this week. We had them every day last week. And I encourage anyone that's interested in a booster, now it's eligible for anybody 18 and over, to get one as soon as they are able. So hospitalizations are up compared to this time last year and have had a general trend over the last several weeks of rising. Again, these are people primarily that are either unvaccinated or have waning immunity. They tend to be older and have comorbidities. We've only had one pediatric hospitalization in the last 30 days.
The clinics, how are we doing in terms of making reservations and crowds and, taking up the spaces? How are we doing on that? Is it relatively easy to get to register for it on a last minute basis?
It depends on the vaccine. Right now, particularly among seniors, the Moderna seems to be of particular interest to seniors. Our clinics have primarily been for people over 65, so they don't have to compete against others that may be able to more easily go to a pharmacy or to another provider. We certainly also make sure that critical infrastructure is taken care of, but we do also hold clinics for anybody that's eligible. Moderna really seems to be what people are interested in.
Okay, thank you, Doctor. Any other questions or discussions for Commissioner Potter?
Yeah, Mr. Chairman, hello, Doctor. Just in terms of the boosters, it sounds like a lot of people are now signing up for the boosters and getting those for the first time. Is that something that also will wane and every 6 months or so they'll go through another cycle of booster shots?
There's really no data to inform that right now. Some countries haven't even started a third dose or are just starting to. Israel has been really at the forefront of the epidemiological analysis of COVID. They were the first to go with boosters, and they are preparing and making agreements to acquire vaccine in case additional boosters are needed for the population.
Great, thanks. Thanks very much, Doctor. Any other questions for either Dr.
Yes, I have.
Kules?
This is Supervisor Winnie. I'd like to commend Dr. Coles and his staff. I had personally in my family, they had COVID, and I just am so proud of our health department because we had to go through Fulton County, and to me, they're way behind Saratoga County. And I just want to commend him and the staff there because when I called, they were right on the money. They got right to my son who contacted that, and I really am assured that they're doing a tremendous job.
Thank you for your kind words, Supervisor. It's truly a team effort, and you know, the resources that the board has given to us allows us to do that job. So many thanks for all you do to support us.
Absolutely. I
Yeah.
think there'd be a group of seconds to that commendation. So thanks very much, Doctor. Anything else?
Chairman,
Sure. Supervisor Gaston.
thank you. I would also second, today is World or National Public Health Day, so I definitely think that recognition is very timely, Supervisor Winnie. But my question's actually for Commissioner Potter. I was wondering if she had an update on Code Blue, since I know it started and we've had a few quite cold days, how it was looking compared to previously. Thank you.
Yeah, Code Blue's been open for about a week and a half now, and it's been pretty close to capacity. 44 people has been the average per night.
Wow.
And since it's only the one location, is overcapacity, is that unfortunately still the backup of hotels?
The capacity is about 60. And what did you say about backup? The executive
If
director.
it goes past that capacity, since I know this year we only have the one location.
He has a plan for backup. If they do get over capacity, and also if that happens to be the case, then we also have to work in our department to try to find resources. But I think we're okay for right now because he has another venue for at least 10 more people if it gets over capacity at the Adelphi location.
Thank you.
You're welcome.
Any other questions or discussion or business? No? Do we have a motion to adjourn?
Yes, I'll make the motion.
Supervisor Lant? Do we have a second?
I'll second.
Supervisor Grasso, discussion? All in favor? Aye. Opposed? Carried. We're adjourned. Thanks very much, everybody. Happy
Thank you.
Thanksgiving.
You too.